Let me ask you something. If healthcare is so stable, why are so many healthcare professionals anxious about their career? And why are interns spending lots of months before they get posted to undertake the internship? And why are graduates frustrated after they're done with the internship to secure jobs? Why are brilliant minds quietly reconsidering their career path? And we are told, of course, get into medicine and your future is secure. But look at what's happening around you currently. Something doesn't add up. Something doesn't add up. And today, I want us to talk about the healthcare career lie that we were sold, not to complain, not discourage you, but to understand this particular lie so that we can move differently after we've labeled it correctly. Because once you clearly see it, then you will stop feeling stuck. Many of us grew up believing that healthcare was the safest path in terms of career that existed at that particular time. You get your high grades, join medical school, enroll for your internship, get a stable job, and your life is sorted. And that was the formula at that particular time. And our parents believed it. Our teachers, they reinforced it. And society, of course, celebrated that. Healthcare meant prestige. Healthcare meant income at that particular time. It meant security. And for a long time, that narrative worked really, really well. But that narrative was built for a different era, an era when government was absorbing most graduates after they're done with their internship, when private hospitals were expanding rapidly, and that came with an increased number of job opportunities for healthcare professionals. That era came with, it was when fewer people were enrolling to healthcare courses. That system has since changed. But the advice that you are given did not change with it. When the system changed, the advice that you were given did not change with it. And that is where the frustration actually began. Because today we see delayed internships, we see limited residency slots, we see underemployment, we see burnout, we see migration as a survival strategy. Colleagues are looking for greener pastures in foreign countries and they're leaving the country. And of course, many young professionals end up feeling very confused because they did everything right. They sacrificed their sleep. They passed their exams. They survived the medical training. It's quite intense. Whichever healthcare profession or course or cadre that you enrolled, it's quite intense. You survived that training. You earned the degree, and then uncertainty knocks on your door. So that emotional gap, it feels like betrayal. And here's the truth. The lie wasn't that healthcare is valuable, or the lie wasn't that healthcare is valuable. Healthcare is still valuable, and healthcare is still respected, is still essential. The lie was that healthcare careers are automatic, that once you qualify, the system carries you, that the path is linear, that security is guaranteed. It is not. That era is over. Healthcare today is very competitive, it's very dynamic. It is ecosystem driven. That is healthcare. It is ecosystem driven. And it rewards strategy. It's not just your qualification. It's not just having a primary degree that gets rewarded. It rewards strategy. So in school, we were trained clinically. We learned about pathophysiology. We learned about diagnosis. We learned about prescribing. We learned about procedures. Of course, patient care. But we were not trained in something that is very, very critical. We were not trained on career strategy. We were not trained on market positioning. We were not trained on healthcare economics. We were not trained on systems thinking. We were not trained on industry structures. We were not trained on digital health, evolution, policy influence, personal branding. We were not trained on these things. We were clinically trained, but not career trained. That is what school did to us. And that gap is what many people are feeling right now. And you could be feeling it. You could be feeling it right now. Because healthcare is not just the hospital as we know it. It is also the pharmaceutical industry. Talk about the medical device industry. Talk about the digital health space. Talk about the research space. Talk about the public health space. Talk about the policy and regulation space. Talk about the health insurance space. Talk about entrepreneurship. talk about medical education, it is an ecosystem of all these things. This is the healthcare industry. But if you only prepare for one narrow lane, perhaps you prepared for the clinical lane, you panic when that lane becomes crowded. And that is what is happening, because many people have narrowed down on the clinical lane, which seems to be easily available. And so they panic because the lane is crowded. Here is another uncomfortable truth that I would like to leave you with, is that many healthcare professionals, they are not unemployed, not necessarily. They are not unemployed. They are unpositioned. And there is a big difference between the two. The market has evolved. Technology has also evolved. Healthcare financing has also evolved. So if you do not evolve with this, you will feel displaced, definitely. But when you understand the ecosystem, how it's working, then you begin to see options that are available for you. And this is not about abandoning your clinical practice. Far from it. It is about expanding your understanding of what your training allows you to do. So some doctors, they now shape global therapy. Some pharmacists, perhaps you know them, they influence the national policy. It could be even a regional policy or even a continental or global policy. Some nurses, they lead public health systems. Some healthcare professionals, they build technology platforms. And they did not leave healthcare. They applied it strategically. And that's where I need you to look at. They applied it strategically. And here is the mindset shift that they had at that particular point. That the solution is not about being angry. It's exploring what is available for you. And that is adaptation. So healthcare careers today, they require skill diversification. They'll require you to step up and be intentional about your positioning. They'll require you to step up and be long-term thinking. Be strategic in your networking. Think about systems. Be system aware. So your degree is not your destination. Your primary degree, that is medicine, pharmacy, could be nursing, or even dentistry. It should be your leverage. And once you see it that way, then you'll stop feeling trapped. You'll start designing how to progress career-wise. The healthcare career lie wasn't that this profession is powerful. I'll repeat it again. It wasn't that this profession is powerful. It is. The profession is still powerful. Healthcare profession is still powerful. The lie was that it will carry you automatically. That once you qualify, your future is guaranteed. That is a lie. That era is over. And today, the degree will open the door for you, but strategy will determine how far you walk. Okay? How strategic you are will determine how far you walk. So the professionals will thrive in the next couple of years, 5 years, 10 years. They're not just those who are clinically competent, but those who are strategically positioned in spaces where opportunities are available. They are those who will understand systems, they'll diversify their skills, they'll design their careers intentionally. So the real question that I want to leave you with is not if healthcare is still worth it. Healthcare is still worth it. The real question is, how are you positioning yourself within the healthcare ecosystem? Because the future doesn't belong to the most qualified, but it belongs to the most adaptable. And that is entirely within your control if you choose to. So if this resonates with you, let me know in the comments section below if this resonates with you. And in my next video, I'll walk you through how to redesign your healthcare career intentionally. See you in the next video.